Welcome to Deep Dive Dialogue. Our topic for discussion today is enhancing breast cancer outcomes with AI, a new era in precision pathology. AI is revolutionizing breast cancer care by improving accuracy and efficiency in pathology. With advanced algorithms, it can analyze tissue samples, detect subtle patterns, and predict outcomes more precisely. This enhances early diagnosis, guides personalized treatment plans, reduces errors, and paves the way for better patient outcomes in precision medicine. We have with us today Mr. Akash Parvatikar. Akash is computational pathologist and medical imaging expert and has earned his PhD in computational biology from Carnegie Mellon University of Pittsburgh School of Medicine. His research focuses on analyzing histopathology images at multi-scale resolution using statistical modeling, machine learning, and deep learning. Currently, he's working with Histowiz, streamlining histopathology for researchers through their platform Pathology Map. Welcome, Akash.
Well, thank you so much, Dr. Manisha, for inviting me to this wonderful podcast, and I'm excited for today's conversation.
So my first question to you is that how can explainable AI enhance collaboration between healthcare professionals and AI systems to improve diagnostic accuracy and treatment decisions?
Oh, well, I think just to take a step back, as you know, that digital pathology is an evolving field, and even AI is becoming so popular. And so we are seeing so many AI tools in the field of pathology, revolutionizing cancer diagnosis. But I think what's important is that to facilitate like regulatory approvals, it could be FDA in the US. I think it's very important for the AI systems to be explainable in a way that it increases like the trust and transparency with the healthcare professionals. Now, it's always sort of like relevant if the AI talks the language of a pathologist. So, for example, if I'm looking at a breast cancer and the AI detects it's a breast cancer, I think it will be explainable if it actually looks at the specific features within breast cancer. It could be like cribriform pattern, it could be the size of the cells and things like that. And then it takes that into account to come up with some classification. So I think it sorts of like sets the platform between AI scientists and pathologists to, do innovation in that direction. And I think it's very important.
So it should talk like a pathologist.
Yeah, absolutely. Yeah.
Right. So, what are the biggest hurdles in implementing explainable AI across healthcare systems, and how can these barriers be addressed effectively?
Well, I think the first challenge would be to incorporate explainability right at the beginning. I think many a time we as AI scientists, we chase like, performance accuracies and all that. And somewhere down the line, we don't take into account like what will be the failure modes of a particular model. So I think the first challenge would be to keep that in mind as you develop model. So what I mean by that is it's okay to have an AI model that gives you like 70 or 75% accuracy, but you should exactly know when the model fails. And I think that's more important. And coming to some other challenges would be to, it's important for an AI scientist to understand pathology. So they need to like sit down with the pathologist and sort of bridge the communication gap between the pathologists and AI scientists and have these conversations as to what are the problems that a pathologist faces, like while diagnosing, where do they actually need these state of the art AI tools to make a difference. And I think it should always be that sort of like like a collaborative effort than building an AI model and then trying to fit into a pathologist workflow. So I think that takes time, and but it's like one way in which we can make and build tools that actually reaches the pathologist lab and makes a difference.
Right. And given the complexity of breast cancer detection, can you give some examples that how can explainable AI reduce diagnostic errors and improve clinical confidence in AI recommendations?
Yeah, I think pre-invasive breast cancer has the highest rates of disagreement. I think it's very well known across the world that there is like a lot of underdiagnosis or overdiagnosis that happens, especially when it comes to the pre-invasive stage of breast cancer. So this could be ductal carcinoma in situ, or it could be atypical ductal hyperplasia, or it could be the benign cases as well. So I think the genesis of that disagreement stems from the fact that a lot of the pathology features within these images, it's quite amorphous. So what I mean by that is there are no clear guidelines uh, in the pathology books as well, which state that I need to quantify these features with this percentage of presence within the tissue to put it as this category. So I think that that's one thing. And second thing is that lot of features overlap. Now you can see like same features in a benign versus like ductal carcinoma in situ versus an invasive breast cancer. That lot of like subtleties are there within the image, and I think like to a pathologist's eye, sometimes it's very difficult to sort of demarcate these subtleties in all of that. So I think where AI would help is again with the help of a pathologist to sort of like use the tools and try to predict like what features like stand out among the specific breast tissues, and in that way it could be then fed into the system to say that okay, if I'm looking at the image, I want to focus on these features, or these features has to pop out for me to make a quick assessment. And it's again hierarchical because as you know, in breast cancer, like if there is a cribriform pattern or micropapillary pattern, then it's not benign. It's not like in the early stages. So there are few patterns which like stands out, and then there are few other features where there's a lot of overlap. So I think given the hierarchical approach, AI systems will help to sort of like classify these regions. And again, the decision is in the hands of a pathologist. Like, the AI systems will not make decisions for you. And I think we are too early over there, but it could be used as an assistive tool, just so that some of the features are not missed. And the doctors could use it as an assistive tool for better diagnosis.
And in what ways can explainable AI support personalized treatment plans for cancer patients, ensuring that decisions are transparent and they are aligned with patients' needs as well as clinical goals?
Well, I think AI is playing a very big role in personalization, and I think uh, the main reason being that now we have a system in place that can sort of analyze like hundreds of thousands of cases, like within a very short span of time, and try to discover trends in unimaginable ways that could be humanly impossible in the past. So I think with AI again, it should be treated very carefully in how we use the system, but definitely like using AI systems to analyze those many cases, and then say you analyze hundreds of thousands of cases and slides, and then there comes a new patient, and now it's very easy to sort of compare the new case to all these previous archived cases, and then suggest treatment plans like what worked, what did not work, and again like keeping things simple. So you might have a case in the past where that particular treatment did not work, so now not to make the same mistake to this new patient. So I think that's where AI will play a massive role. It's all about like analyzing from huge volumes of data and trying to see how it could be best used for the benefit of the patient.
So it is pattern recognition as well as matching it with the patient.
Absolutely, yeah. So,
My last question is that how will advances in explainable AI shape the future of clinical research and precision medicine, particularly in improving patient outcomes and accelerating discoveries in cancer care?
yeah, so I think the opportunities are endless here. So I think we are seeing AI getting into like each sector within the pathology community. So at Histowiz, we use it to detect like commonly occurring quality control issues. So we are driven towards producing like high quality histology data set, and we use AI day in and day out to automate like the QC process, wherein it's again investigated by a human expert, but we use AI very frequently to detect the quality issues. And again, that has given us a huge jump to produce high quality data set. So that is at the at the initial stage. Now, once we have the high quality data set, what next? The next would be to identify features within the image. So this could be done by the pathologist, and I think features like mitosis or identifying tumor cells and all that, I think it takes a lot of time by a pathologist, and correct me if I'm wrong, because so I think AI could come in there to sort of like automate some of these processes and quantify the result regions. And as you know, we are currently facing a global shortage of pathologists. It's a well-known fact, and over the next 10 years, the numbers are declining, and the number of case sign-outs for each pathologist is increasing, and that puts a burden on the pathologist. And having tools like this sort of like eases the process to handle more cases with more efficiency. So I think the opportunities are many out there in the field of pathology, but it's more like making those quick gains and see how it improves pathology workflow, than focusing on building an AI to completely do the case sign outs and detect cancer for you and all that. I think we will be thinking too futuristic here, but I would say like take simple steps and try to see how you could use the innovations that's happening now to have some quick gains, quick improvement in the workflows and all that. So I think we'll just wait and watch what's the future. So,
Yes, I fully agree that as AI and computational pathology, they continue to
yeah,
evolve, they will unlock new possibilities in precision medicine,
exactly.
and definitely it will drive the research faster and for better diagnosis and accuracy. Thank you so much,
Absolutely.
Akash. Thank you so much for joining us today.
Thank you so much, Dr. Manisha. It was a pleasure talking to you.